Consumers for Healthcare is currently working now to develop a new position because there's a dire shortage of dentists in Ohio and around the country. And so you have the dentist, and the new position will be called a dental therapist, and then there's the dental hygienist. And so the dental therapist will be the person who is able to do simple extractions and fillings and can take some of that load off the doctor. And so that is something that we're looking at introducing next year into legislation in the state of Ohio. In terms of vision, the Affordable Care Act is not perfect, so dental and vision are not extensively covered in that because, again, of the shortage of professionals in those areas.
If I could, I think one of the other things that's unique in Summit County relative to some of this care is that under the Affordable Care Act, there's the physician-centered or the patient-centered medical home. And the Ohio Department of Health is working, Director Winslow seems to be on a real mission to promote that throughout the state of Ohio, where you have these teams that are led by a physician around the patients. And this is a model, the medical home model, you may have heard of that, but really promoting that very strongly in Ohio so that these teams try to assure all the needs of the client are taken care of. Well, there's a model above that, care organizations.
Ohio Patient Centered.
I'm sorry.
Collaboration.
No, the hospital should be accountable care organizations. Accountable care organizations, which do at the system level much the same thing, so that the hospital is now accountable for the patients. And you heard some of that, where readmissions should be cut down and that they have a larger role in assuring all of the care of those clients are taken care of above the physician. What Summit County has done uniquely is created an affordable care community model. This is, if you Google that, you'll find Summit County. Nobody else is doing this. This is very unique, where all of the partners in the community, from mental health to oral health care providers to the physicians to the hospitals, social service providers, all have a role, a connected role in assuring the care of the individuals. And that covers their social needs as well as their health needs and these specialty needs as well. And these are all connected through what is being supported from the Affordable Care Act and the health information technology, where all of these partners can be linked and share information in an efficient way that you don't have to be filling out the same forms everywhere you go, that when you go to a different doctor, they can see your background, they can see your medical history. And we're very hopeful that public health can get linked into that system so that we can not only provide care and be able to access that data, but for uses in identifying trends in the community, these disparities, to collect the information, interpret it, and report it out to the community. I think that's a fundamental role that we can play in this as well. So that's, I think, going from the patient-centered medical home through the accountable care organizations to what we've got uniquely, the accountable care community, I think is an awesome model that a lot of people will be looking at.
And currently there are 50 sites now in the patient-centered medical home. Me speak up? Really? Okay, Ms. Barber. But there are currently 50 of the patient-centered medical homes within the state of Ohio. They have a pilot, and again, I can't say enough in terms of if you want to be involved, get involved in the Ohio Patient-Centered Primary Care Collaborative. We will give you that information. It's available on the back table. Your voice matters. And the more you speak, the more you demand. We know that it makes a difference. In the 60s, we would say the revolution won't be televised, but now it will be on Facebook, tweeted, and text.
I think we're going to try to shorten our responses. So we are going to try to shorten responses. I hear in the question a concern to make sure that we have access to special medical services. And as a legislator, I will do what I can to make sure, I'm listening to you, that you want to make sure you have access to special medical services.
Thank you. We have quite a few questions, so if our panelists could limit our responses, we can try to get to as many as possible. Thank you. The next question is, does the 138% poverty rate for Medicaid only apply for Ohio, or does it apply nationwide?
That is actually a nationwide model, but it can go up to about 400%. So that's the bare minimum, but Ohio is looking at perhaps reducing that 138% to just 100%, but the baseline is 138%.
Thank you. This question is about community health workers. Who hires them, who pays for them, and how is their role different from personal care aides or Medicaid transporters?
The study that we are currently conducting to find out who is in fact using community health workers. And the way we see this, or the way we envision this, is that local centers, they don't necessarily have to be healthcare centers, they can be cultural centers where people are. We'll be doing the hiring of those folks. We're looking at what it takes to be a community health worker, what type of education, what's a fair amount of money, and what are some of the additional responsibilities other than those I talked to you about.
This next question is regarding small businesses. How or where can small business owners, where can they look for information regarding their employees? And does the size of their business, as far as how many employees they have, matter regarding what kind of coverage they have to offer?
For those businesses that are 50 and under, there will be subsidies available to these businesses and also tax credits. With I'll just give you a quick example with mine, for example. My employer, which is a small employer of under 25 people, they pay $575 towards my health care cost. I pay an additional $250. If I want to add my husband, it's another $900. So small businesses will not be bearing the brunt of this themselves, and there is a tax credit available to them.
This next question is about government-managed health care. It essentially asks, if the government is running a program, how can the public ensure that it's going to be effective and efficiently managed?
That's a good question. We are in the business of trying to make sure we evaluate all of our programs. And the public wants to make sure we are accountable. And to be accountable, we need to make sure that there's transparency, the records are open. But we have put a new office, and we're calling that office the Health Transformations in the state of Ohio. We're putting a lot of emphasis in it to try to make sure we monitor and evaluate and assess the health programs and health services for the state of Ohio. There's a lot of changes being made to try to ensure that there's competition in the system and accountability in the system, transparency in the system. But we need your input in this process to make sure that we are providing adequate services at the right prices.
The next question is, how can the public eliminate the fear of death panels that have been discussed and thrown around?
There aren't death panels.
Well, I think the question is referring to perhaps the last presidential election, Sarah Palin saying there were death panels, and they seem to be more of a evidence-based panels that look at what doctors use and some of the best practices. So how can the public get out there and use terminology and information to dispel that myth?
The death panel charge. I think part of what we heard earlier was about quality care, and I think that that was changed and morphed into something it wasn't. But one of the things that they were trying to promote is the idea of a standard delivery of care, so that when somebody presents with a certain condition, that these are the steps and this is the care that is provided in a fairly consistent way. And I think that that was the attempt to try to build a system that provided a consistent degree of care. Well, that turned into, well, at the end of life, here's what we'll do. We'll make decisions on what that standard of care will be, and we'll make decisions on who lives and dies. That's ridiculous. That was never the intent, and that wasn't where this was headed.